Hello everyone, and welcome to Simple Therapist. Now in this video we're going to be going over things to look out for with regard to seeking therapy. Now a little bit about myself. I am a social work practitioner who's been in the field for around 3 years. I'm also in grad school pursuing a master's in social work. So I'm definitely not a licensed professional. That is definitely the goal, but these are just some things that I've heard from other people as well as things that I've sort of accumulated with regard to knowledge within school but also within the field. So first things first, this conversation can definitely be a bit nuanced, a bit complex, so I try not to speak in generalities, but at some point it's inevitable. So a few things to keep in mind right out the gate. If you are going to a mental health professional in order to get a better understanding of your world from a more clinical lens, from a professional, that is absolutely valuable. Now, if you are going to a mental health professional in order to understand the world around you and you're looking to do something about it, then it is absolutely worth seeking a mental health professional. I think where it becomes interesting is in two instances that we're going to talk about today in this video. And the first one is a phenomenon that I've seen many experts speak about, but also something that I've sort of seen, within the field as well. This phenomenon is beginning to appear among emerging adults, adolescents, that population in particular. But first, I'd be remiss if I didn't go over definitions. I think definitions are super important. Now, what is a disorder? It is an illness or condition that disrupts the mental and physical functioning of the body. That is as simple of a definition as it gets, but I'm going to do my best to conceptualize this idea. This is something that I've bounced off of professors within my grad program as well as my internship. Now, within our Western society, and I'm speaking specifically for a reason, I can't really account for Eastern society or other societies that I'm not familiar with, but within it, we are expected to operate within a certain capacity. We're expected to go to work, go to school, socialize, build relationships, complete our daily necessary tasks, things of that nature. And when we as people are not able to fulfill those tasks, that can be a sign that a mental health disorder is taking place. Now let's take OCD, for example, or obsessive compulsive disorder. Now this one's a tough one because I think I saw a study recently that 50% of people who have OCD are misdiagnosed initially. So it takes some time to get around there, but bear with me with this example. Let's say you're experiencing intrusive thoughts that are persistent, draining, or make you doubt who you are, things that you know to be true. Let's say you're experiencing compulsions, like checking things over and over again or repeated actions in order to eliminate those persistent thoughts. If these experiences are impacting your daily functioning, they are severe, they are within, or moderate or severe, they are persistent within one or multiple settings, then that can be a sign that you do have a mental health disorder, and it would be beneficial to schedule an intake or some sort of phone screening with a mental health professional, preferably like an OCD expert or specialist. Now, to be clear, obviously I do not have a license, and it is not so simple as if you are experiencing these things, you have OCD. In fact, most people may from time to time experience some of these things that I'm mentioning, which is all the more reason why it is important to consult a mental health professional or therapist. Okay, so here we have a study that was conducted in Canada. Looks like it was conducted last year, and it's called Self-Diagnosis in the Age of Social Media, a pilot study of youth entering mental health treatment for mood and anxiety disorders. Now, while I was scanning this study, I think what really captured my concern was sort of highlighted in the introduction portion of the study. It says here, attention deficit hyperactivity disorder content is particularly popular on TikTok, and sites often encourage users to diagnose themselves. While youth also spend on average over 8 hours per day on entertainment screen media, there is evidence that this shortens attention span, degrades prospective memory, and reduces ability to complete tasks. So my sort of beware disclaimer in this video today is to be on the lookout for certain tendencies, either amongst your clients or amongst yourself, especially on these digital platforms that are sort of reinforcing this idea of self-diagnosing before seeing a professional. Now, this is an issue in particular that's pretty separate, but it sort of encapsulates the culture that is feeding into these users that are on digital platforms and are creating communities on Instagram and TikTok, etc. So let's take a look at this. Similarly, a number of studies show that social media use is associated with worsening self-esteem and depression, and depressed youth do not have to look far to find solidarity in depression-related content on social media sites. Hashtags such as #MyDepressionLooksLike lead users to first-hand accounts of depressive disorders. Principles of mimesis, imitation, and replication are encouraged by the design of social media platforms. So it's sort of reinforced, whether it's through algorithm, whatever, which is particularly concerning when considering hashtags such as #SecretSociety123, which connects users to self-harm. Now, in this study in particular, it looks like 57 young adults participated in two sort of screenings or questionnaires prior to their first appointment with the mental mental health professional. They completed the social media engagement scale for adolescents, as well as a questionnaire inquiring about their viewing materials online, specifically mental health content, as well as thoughts about their mental health diagnosis. So all participants viewed mental health content online, and social media sites were the more commonly used ones. I don't mean to bash on Instagram and TikTok, but if you look at the pie here in the middle, it looks like Instagram, TikTok, and YouTube were the primary culprits. The study found that viewing mental health content online was correlated with perceived importance of mental health diagnosis. They were trying to confirm this concept that was formulated in their brain after being exposed to the mental health material, the depressive related stuff, etc. 71.4% of participants self-diagnosed with a mental health condition, and most indicated social media contributing to this belief. Participants who self-diagnosed had higher SMESA scores and higher frequency of viewing mental health content on YouTube. Diagnosis was important not only for practical use of guiding and accessing treatment, but listen to this, but also for validation, insight, community, and understanding from others. So there's so many variables at play here. It's not just inquiring about their individual experience, as I mentioned in the initial phase of this video, but also fostering or reaffirming this community, this belief, being a part of what they're witnessing online here. It's also a scary sight that once they have this idea in their mind, they want it to be validated. Now, not a single soul should have 100% absolute conviction in the study or the contrary. It's important to keep in mind that this was a sample size of 57. It was a pilot study, and as far as like how it maps out on like the hierarchy of evidence, it's pretty low. But this was simply a way to add on to the greater picture here, which is being careful and being responsible when seeking out mental health professionals. Now, what I'm sort of getting at here is, while social media, for example, is a blessing and a curse, so is the normalization of mental health being in the mainstream. Personally, I do think it is a net benefit, but you can see how not only through professionals that are on these platforms, these social media platforms, but also just random TikTokers or the layman person sort of sharing their experience, there can be some negative outcomes as well. When you see all these TikTokers on your feed and how confident they can sound with no understanding of their background, their credibility, nothing. They speak with such conviction, and that feeds into this feedback loop that is self-diagnosing. They subsequently look to confirm these beliefs as opposed to inquiring, explaining to the clinician their symptoms and experience, and letting the professionals do their job. Now, when you have someone who's, let's say, operated in the world for 30 years and they say to themselves, I think I have anxiety, I still have my six-figure job, I go to this soccer league on the weekend, I have a stable relationship. If I were to get diagnosed, I probably wouldn't do anything about it, but I'm just curious, I want to know. This can potentially, and I say potentially very clearly, potentially be problematic. Could a diagnosis of generalized anxiety disorder without the intention of changing your maladaptive behaviors result in diagnostic overidentification? Now, that's a big one. What does that mean? Diagnostic overidentification is when a client defines their entire identity, self-worth, and capabilities by a mental health diagnosis or a trauma label. You begin to develop these excuses about certain behaviors or lack of action because you have your disorder. Diagnosing without a drive towards treatment can be concerning, at least to me. So let's say you get your generalized anxiety disorder diagnosis, the thing that you've been looking for. It is possible that it can foster an environment of stagnation. Now, this is simply a potential outcome, and this option should be factored into the equation when seeking a mental health professional. I just don't think this phenomenon is spoken enough about, and I wanted to make a video to shed light on it. Now, I had a hard time finding research that sort of supports this phenomenon that I'm trying to describe, but why? My guess is that it's very hard to operationalize or turn diagnostic overidentification into something that is measurable into a study, but no one can tell me that this is not happening. It just is. It's fact of the matter. I hope this video was helpful. Make good decisions. The study that I highlighted in this video will be in the description below. Thank you all so much for the support, and have a good one.